Good, everyone. We're going to go ahead and get started. We have just a short amount of time together today, so I want to be sure that we're making good use of it. I can tell from our online software that we have a good group here with us today, so I'm really excited that we have some time together. Again, my name is Angela Precht. I'm calling in from the Michigan Public Health Institute, and I have my colleague with me today that I'll let introduce herself.
Good morning, this is Robin Vandermoor.
As I mentioned, we're really excited to have everyone here today to discuss just sort of a brief introduction to quality improvement and the CQI learning collaboratives related to MIECHV and the Michigan Home Visiting Initiative. This comes for a couple of reasons. We've decided to meet up today virtually together. I'll talk a little bit more about why CQI is an important component of our MIECHV work, but most immediately, you all know that we have a meeting coming together next week where we'll be getting together to kick off our 2015 learning collaboratives. We know that things have changed over the last couple of years where those who were originally trained in our CQI methods might be able to benefit from a refresher, and that we've got some new staff who haven't benefited yet from our two-day CQI training. So we were hoping to get everyone together just to give a brief introduction to quality improvement and just kind of get everybody on the same page and talking the same talk about quality improvement and learning collaboratives before we have the pleasure of seeing everyone in person next week. So I think it's always helpful. We've introduced ourselves, but it's helpful to know who else is on the call. So what I'd like to ask is we might just break it out into our models. If you are on the call from a Healthy Families America program, would you mind just letting us know that you're here and where you're from?
Responding for Children, Healthy Families America.
Welcome, Kelly.
Jody Spicer. Sorry, this is Jody Spicer from Ingham Healthy Families.
Good morning, Jody.
Elaine from Wayne County Babies, Families America.
Mary Lane.
This is Cynthia Brin with Ingham Healthy Families.
Yeah.
This is Tita, and I'm here with Julie Kozan, and we're from Saginaw County Healthy Families.
Healthy Families, Ingham.
Pamela Smith, I'm also with Saginaw.
From Healthy Families. Oh, sorry, go ahead.
Hi, Aunt Shout from Ingham Healthy Families also.
From our Healthy Families America programs. Early start.
Liz Costa from Centro Multicultural Familia in Pontiac. Thank you.
MIECHV participants. Great. Move over to our Nurse Family Partnership programs. Anyone on the call from NFP?
Halal from Hurley Medical Center Nurse Family Partnership.
Welcome, group. Amy, we're happy to hear your voice.
Also from Kent County. I have Emily, Sequoia, Eva, and Joy with me also.
Thanks for calling in, Kent team.
Hi, Rebecca from Saginaw County, and I have Leah and Deb here also.
Any other NFP programs out there?
Just one, you're also listening in. Thanks.
Hi, good morning.
Good, everyone. Didn't make it on from Ingham County NFP? Oh, God, I'm sorry. She's in Denver this week, Mad.
No problem. Any other NFP participants?
What?
Any other of our partners from MDCH on the call?
Yeah, I thought, yeah.
And lastly, do I have any other MPHI colleagues on the call. Okay, team, we're going to move forward. One point of housekeeping. Remember that we are all on this conference line. We can hear anything that's happening in your office if you are not on mute. So what I'll ask is everyone to put their lines on mute. They'll be able to hear clearly, and if we need to unmute so that you can ask questions, please feel to do that, but it's best if everyone sort of stays standardly on mute as we conduct this webinar. This is also being recorded today, so if you want to revisit it in the future or have colleagues who are unable to join us today, we'll make sure that we post this on the SharePoint once it's available through the WebEx software, and that'll be a place that people can go for additional resources in terms of introducing CQI to new staff members or refreshing. As I mentioned, about continuous quality improvement. We're going to go through the fundamentals of CQI, and we're going to talk about the particular method that we like to use in CQI methodology, and that's the Plan, Do, Study, Act cycle. And we'll talk a little bit more about what that is and what you can expect from it in a few moments. We'll dive a little bit deeper into what CQ learning collaboratives are, what we see as the benefit to conducting CQI learning collaboratives and participating in them, and the structure of the collaborative meetings as you can expect them moving forward. And of course, we'll try to make sure that we have some time at the end for any questions that you all may want to ask us or ask each other about CQI and the learning collaborative approach that the Michigan Home Visiting Initiative has chosen. And I should say, you have any questions, feel free to unmute yourself and just go ahead and ask. We want to make sure that you have all your questions answered moving forward. And I remind everybody to please mute your lines while the webinar is being conducted so that we can all hear clearly the content and questions coming up. Before we start, what I'd like to do is just actually give a brief introduction into the connection between MIECHV and quality improvement. For some of you, you might not necessarily know
Share that. Going back.
We've got everybody's on now.
So what I ask is everybody to go ahead and put your lines. We're going to see if we can help improve the audio. If everyone will mute your lines, we'll see if we can kind of get us back on track to hearing.
I want to know what the over-under is for how many times they ask to mute your line.
You're not muted.
So teams, I can still hear a lot of you on the line. If you can go ahead and press mute on your phone, that would be really helpful. We're already muted, and it sounds like our noise has been a little bit improved. I'll ask one person out there. Rosemary, can you hear me clearly?
I got cut off and dialed back in, but I can hear you, Robin. I'm sorry.
No worries. Actually, Rosemary, it sounds like we might have been disconnected from you in how we were muting. What was the last thing you heard, Rosemary?
The introduction to CQI and how the fundamentals use the PDSA cycle.
Wonderful. So we'll just move forward from there. I have a hunch that we may have been sort of disconnected audio-wise in talking about these fundamentals and what we'll be talking about today. So just to get us all back on the same track, today we're going to just talk about those fundamentals of CQI. We're going to talk about how we use CQI and the particular method, and we call that the Plan, Do, Study, Act cycle. We'll talk about learning collaboratives, what they are, why we use them, what the benefits are of CQI learning collaboratives, and what you'll expect moving forward. I did give just a brief introduction as to where the connection is between CQI and why you might be hearing CQI a lot in relation to the Michigan MIECHV home visiting initiative, and that is truly that our two most oversimplified obligations in terms of the MIECHV funding stream is first to collect and report data related to those important and critical benchmark areas of home visiting that gives the federal government a snapshot as to how home visiting in Michigan looks and what it looks like and what we're doing, but also to use a structured approach to improve in those critical areas. So not only to be letting the federal government how things look in terms of Michigan home visiting, but to actively be working on improving in those critical areas of home visiting. We do that through quality improvement, and that's why we're talking about that today and why we use learning collaborative approaches. We'll talk more specifically about Michigan and what you'll expect to see in our learning collaboratives in just a little bit. So diving into quality improvement, we're going to talk about a definition of quality improvement. I want to give you an overview as to what the benefits are. Also, talking through the confusion sometimes we see with participants between quality assurance and quality improvement. And I'll share with you the 4 basic principles and 3 key questions of quality improvement. Here you see a very, very long, convoluted, complicated definition of quality improvement. And what I'll ask you to focus on are those areas that are bolded. It's really likely that your team and your program already uses some sort of quality improvement method, but likely it's maybe not in the same very structured approach that we're looking to make sure that we're conducting on a regular basis. So again, look at those bolded areas of the definition that you see on your screen. The QI in terms of that we are talking about is a deliberate and defined improvement process. So this is using a structured approach. We use the Plan, Do, Study, Act cycle. And it's really continuous and ongoing to achieve measurable improvements in indicators of quality of services. So it's truly just, in the most simple terms, it's a structured way to take a process that could use some streamlined or efficiencies, and it's applying that particular method to see if there's an improvement in the process. That CQI is. CQI is cyclical. It's something that actually you'll go through multiple stages and multiple steps. You'll move forward and backwards in that process, and you'll move smoothly from one PDSA cycle or one QI project to the next. CQI is built on group consensus rather than hierarchy. The changes that your team is going to try out, these aren't something that's just prescribed from one member of your team. This is something that's really meant to be a team effort as opposed to sort of a top-down approach, someone deciding where the focus needs to be for change and what that change will be. CQI is really meant to be a supportive process. This is not a punitive process to say, so is not doing this process correctly. It's really to say there's something that we might be able to do a little bit better. Let's, as a team, identify the improvement that we can tackle and how we might try that out. So it's meant to really be supportive rather than punitive. It's focused on communities improving their services from within. You all know what's happening in your communities and your programs best, and CQ is really a way for you all to take that knowledge and that expertise and improve the services that you're providing from within your own program. As lastly, CQI is rooted in a desire to learn, improve, and ultimately serve families in a good way. As you'll see from our 4 basic principles, the focus really is a customer focus. We want to make sure that families are receiving the best services possible, and CQI is a way to really try to get processes one step closer to being efficient, effective, and really helping serve families in the way that we all know that we want to serve them. It can be a tough sell, I think, to talk about adding another project or another layer of work. But I think that a sell here of QI are these things that you can see on the screen that QI can do for your teams and for your programs. We know that quality improvement can streamline processes. It reduces redundancy and really enhances your program's ability to meet the needs of your families. We've certainly seen and know from the quality improvement literature out there that QI increases family satisfaction with services, and all that really comes back to improving the outcomes for the families that are invested within your programs and that we ultimately want to serve and to our best abilities. We sometimes hear some confusion between quality assurance and quality improvement. So let's talk a little bit more about the difference between quality assurance and quality improvement. It's very likely that you have seen aspects of both of these things within your organization and your program specifically, but we want to kind of pull them apart so that we see the differences. Quality assurance is something that guarantees quality. Quality improvement, on the other hand, it raises that quality. So again, looking at not only telling the federal government in this particular aspect of home visiting, telling the government how home visiting is looking and where our quality, our measurements of quality stand, but using quality improvement to raise that quality, to make those numbers be higher or better in some way. Quality assurance relies on inspections. So it's something that's being investigated as something, as a process occurs or after the process occurs. Quality improvement is looking forward. It's looking at making a change so that something is improved in the future. Quality assurance is reactive, just like that last bullet of relying on inspection. It's something that happens after another process occurs, whereas quality improvement, in emphasizing prevention, really looks to be proactive. Quality looks at compliance with standards. Are we meeting the marks that we set out to? Are we meeting our goals? Quality improvement itself improves the processes to meet those particular standards. Quality assurance requires one specific fix, whereas I mentioned that cyclical nature of quality improvement. To really improve the quality and to improve processes, it requires continuous efforts that kind of repeat themselves over and over and continue into the future. It's not something that you'll just do once and move on from. Quality improvement really requires that continuous effort. Quality relies on individuals to meet the standards, to guarantee the quality, but quality improvement really is a team process. It relies on teamwork of the quality improvement team and those who they incorporate into their quality improvement activities. Quality assurance examines criteria or requirements, whereas quality improvement really focuses on the process, on the outcome of those processes. Quality asks, do we provide good services? The process of quality assurance really answers that question, whereas quality improvement asks, how can we do this better? How can we provide better services? Gives you an idea of the difference. We oftentimes talk to participants who say, oh, we do quality assurance, but when we do quality improvement, but when we dive a little bit deeper into that, we find out that it's really important to pull aside quality assurance from quality improvement to be able to focus on these quality improvement requirements and activities. Talking a little bit more about the basics of quality improvement, we have 4 basic principles that we think are really important foundations to establish when you're learning about quality improvement and sort of why we do it and what's important. The first basic principle of quality improvement is to develop a strong customer. In this case, it's a strong family focus to continually improve all processes. So like I mentioned, this isn't something that's only focused on one process or only going to happen once. It's something that takes a look, a comprehensive and continuous look into all processes that go into the outcomes of your families and your programs. Quality improvement involves employees. It's really meant to be a team approach that uses the expertise and experience of all members who are invested in the particular program or area that we're working on. And quality improvement also mobilizes data and team knowledge to improve decision making. So we'll walk you through both in person and over the phone in providing you all technical assistance as your quality improvement projects get underway or are underway. We'll help you look not only at the numbers, the data that come out of perhaps some of the data collection efforts coming out of MPHI and our MIECHV data, maybe some of the data that come out of your own data systems and your site-specific programming, looking at the hard and fast numbers, but also really tapping into your teammates' knowledge, the knowledge of the workers who are on the ground doing all of this, to really combine both of those things to improve the decision-making, both within QI and the processes of your program. There are questions that really help guide you in your quality improvement efforts. We're going to revisit these as we go through the planning aspects of your quality improvement process, but it's always good to get a sense of these when we're introducing quality improvement. We'll always want to ask ourselves, what is it that we're trying to accomplish through this quality improvement project or initiative? How will we know that a change is an improvement? Where did we start out? Is this really a problem? And how will we know that, that the change that we've tried out is an improvement itself? And lastly, asking what changes can we make that will result in an improvement? Really critical to revisit throughout your planning process and moving into new projects. So you'll hear us revisit these key questions a lot in the support that we provide to quality improvement teams. All about the process. We're really focused on improving an existing process. We're also really focused on using data as a foundation for our decisions. Not only the data that come in numbers and come in percentages through all of the data collection efforts of your program and the Michigan Home Visit Initiative, but also the knowledge, perhaps the more anecdotal knowledge of your workers, of your clients, of your families. And lastly, it's really all about learning. This process is all about taking a dive into something where you think you might be able to learn a little bit more about your process and about a solution to that, and really tips into the importance of learning about your programs, your processes, and how to get better and better. We use the Plan, Do, Study, Act cycle. This is our sort of flavor of quality improvement that we focus on in Michigan. You may have heard of other quality improvement methods like Lean or Six Sigma. We do Plan, Do, Check, Act, PDCA, or Plan, Do, Study, Act. This is a method that was made popular by W. Edwards Deming, and it's something that's widely used by quality professionals, process improvement engineers, and healthcare professionals. We really found the PDSA method of QI to fit really nicely in a public health context and also be a fairly simple method to be able to follow. We find it to be quite user-friendly. This is a science-based methodology. It's data-driven, as I've mentioned, and it's an iterative process that continues and it keeps going. It turns ideas into action and really connects that action to learning. And you'll see that in a minute through a that we have coming up. This is, I think, a really helpful and simple diagram that shows you the cyclical process of the Plan, Do, Study, Act cycle. There are 4 stages: Plan, Do, Study, and Act. And within those stages, there are actually 9 steps. These are all repeatable stages and steps that you may move forward and backwards back to. And it's something that can be used by one person, a full team, or a full agency. You'll hear us talk more and more about the team approach. It's something that we certainly recommend, but it is a method that can be used on a larger or smaller scale as well. And as I mentioned, PDSA in this particular realm of quality improvement really needs to focus on existing processes. This is not a method to use to introduce something completely brand new in terms of a brand new process. It's meant to be an improvement to an already existing process that could use a little bit of tweaking. There are 4 stages of the PDSA cycle. The first is Plan. There are 5 steps in the plan stage. The first is getting started and bringing your team together. You're also going to, as a team, examine the current approach, learning a little bit more about what's happening within your program, or diving deeper into understanding the process that you think needs to be improved. As a team, using some structured ways that we're going to walk you through and show you, particularly when we see each other in person next week. Brainstorming potential solutions to the problem that you've identified, and coming up with an improvement theory. The quality improvement projects, as we do through PDSA, require you to come up essentially with a hypothesis. You're going to, as a team, decide if we try out this particular change, then we expect to see something occur. And that's your improvement theory that we're going to help you develop as you move forward with your quality improvement efforts. Next stage is the do stage. This is when you're really testing out that theory for improvement and trying it out, going into your program, going into your process, and try out that particular improvement. Our next stage is the study stage. This is when your team is going to look back at your quality improvement efforts. You're going to look at your data and your process, and you're going to study the results. You're going to see where things wound up in comparison with the baseline data that you'll collect in the planning stage. And this is where your team is really saying, what happened during this quality improvement project, and did we see the improvement that we were looking for? Lastly, your final stage in the PDSA cycle is the act stage. And this is really where you're going to decide, is this an improvement that we want to standardize throughout the rest of our program or our agency, or is it time to try something new? And then you're also, as a team, going to think about your future plans. How are you going to communicate these changes? How are you going to communicate your quality improvement efforts? And what will you do with this in the future, particularly in terms of continuing quality improvement efforts? This is a diagram that I mentioned earlier that I think kind of gives a sense of a couple of things. First is the cyclical nature of quality improvement. So as you can see from this diagram, as your team moves through multiple stages and multiple cycles of the PDSA methodology, not only are you going to see continuous improvement within your processes and within your program in general, but you're also going to see your team and your program increase their learning and understanding not only of the PDSA methodology, but of how things are being done in your program, what best practices are within your program, your model, or within your topic area, and really feeds into that connection to the learning aspect of continuous quality improvement. A minute just to ask if any questions come up from what I've talked about in terms of basics to quality improvement. Any questions? Forward. If you do have any questions that pop up, feel free to unmute yourself and ask away. We'll have some time at the end also for more questions if you need a little bit more time to come up with them. So let's talk a little bit about why we use CQI. We talked about why QI is important, but we'll dive a little bit deeper into the specifics of why Michigan is really investing in this particular methodology when it comes to our Michigan Home Visiting Initiative. So as you may guess from some of the background that we've talked about, CQI methods and tools are used to really make sure that models are delivering the best services possible to families with fidelity. So really meeting up with the expectations of your model, delivering services as they were intended to be delivered. And really, we're using CQI to make sure that the home visiting system within Michigan meets the performance benchmarks required by us through HRSA, and that we demonstrate positive outcomes for families. Going a little bit further into that requirement that I touched upon at the beginning, there is an expectation that within 3 years, Michigan as a whole, in our Michigan Home Visiting Initiative, that we demonstrate improvement in 4 out of the 6 benchmark areas by making improvements in over half of the constructs in each benchmark area. Now, I'll kind of break apart what those benchmarks and constructs mean and give you examples of both of those if that terminology is is familiar or new to you. But I think what's really important about this is that a part of our funding expectation is that as a whole, Michigan is going to demonstrate improvement in 4 out of the 6 benchmark areas by using that structured CQI process that we're helping you all out with. Reminder, we have 6 major benchmark areas. These essentially are those critical measurement areas that have been decided, tell an important story about home visiting in not only in Michigan, but across the United States. Those benchmark areas are to improve maternal and newborn health, child injuries, child abuse, neglect, maltreatment, and reduction of ER visits, improvements in school readiness and achievements, seeing a reduction in crime or domestic violence, seeing improvements in family economic self-sufficiency, and also, lastly, seeing improvements in the coordination and referral for other community resources and supports. So these are our key benchmark areas that we are recording data on and looking to make sure that we understand how these things are working in Michigan home visiting programs and working to improve these things in our Michigan home visiting programs. Each of those benchmarks, we have constructs. So this is just one example, just to kind of bring it down to a more specific level that might help. Looking at, let's look at the first benchmark area, improving maternal and newborn health. You can see that under that benchmark area, we have multiple constructs. These are things like prenatal care, parental use of alcohol, tobacco, and other drugs, preception care, interbirth intervals, screen for maternal depressive symptoms, breastfeeding, well child visits, and maternal and child health insurance status. So you can see that within this particular benchmark of improving maternal and newborn health, we have multiple constructs that we've defined within the state of how we are measuring that improvement of maternal and newborn health, and that's through these specific constructs. Our benchmark area has specific constructs underneath that are a bit more specific ways to measure that particular benchmark area, and this is one example of that. So we strategy in those requirements of not only telling a story of what home visiting in Michigan looks like, but also improving home visiting processes in Michigan and outcomes for families invested in home visiting initiatives. This happens at the local state level. MPHI reviews data with our teams on a quarterly basis. We do this with our local programs, so that's all of you on the call. Your local programs are engaging in quality improvement efforts. We're also doing this at the state level. So we have a state home visiting work group that's also conducting perhaps you could think of it as more of a system-focused quality improvement process, looking at improving quality improvement processes across the state of Michigan with all of our home visiting programs. So we work with the local and the state programs in reviewing data on a quarterly basis. We help them identify opportunities for improvement in benchmark areas, and this is something that both our local programs and our state home visiting work group they are doing. And they're using quality improvement methods to make those improvements, both at the local and at the state level. We have a system-wide CQI project model that we are using a learning collaborative approach to do. So not only are you expected to participate in your own your own quality improvement activities specific to your program, specific to your site, but you're also going to be participating in a learning collaborative approach to quality improvement, where we kind of focus on a system, and we'll talk a little bit more about what learning collaboratives are and what you can expect. For those of you who are in a program that's participating in COIN activities, I should mention that the COIN activities are considered to be that first bullet, your local CQI effort. So about learning collaboratives, let's talk a little bit more about what that is. Learning collaboratives models are used widely in healthcare settings to translate what is known about what works about a particular process or a particular area of work, and it translates it into practice. We are seeing a lot of learning collaboratives being used in public health and in home visiting settings. It's something that MPHI has been involved with in multiple settings, and it's really a model that we feel like instills collaboration, communication, and a lot of networking among those who really know how to make the improvements that are needed on the ground. It's a chance to bring practitioners together to share insight into a common challenge, to see the gaps, and to really think about as a group, what are areas or what are things that we can do to bring improvement to this particular challenge that we're all facing. Very clear benefits to participating in learning collaborative activities. We feel that by participating, you can increase staff knowledge and competency in using QI. I think the collaborative approach of working a bit more in a group is a great way to learn the QI methodology. It really brings an awareness of resources. So across communities, amongst other programs, it gives a sense of other resources that exist outside of those that you initially know of from your own program. It helps you hear what others have tried. Really being able to talk to other programs and other models about what works for them, what doesn't work for them, and what challenges and solutions have been experienced by that particular program. I think that's one of the largest, one of the most positive things that we hear from people who participate in learning collaboratives, that connection with other programs is really, really critical. It gives a chance to ask questions, to share stories, and to really get good feedback from other home visiting models, our MDCH those at MDCH who help support efforts, and those at MIECHV who are supporting your efforts. It's a really great chance to get that kind of feedback. Also, to get tools that you can tailor to your home visiting program. Very frequently in our learning collaborative meetings, webinars, and other communications, we will hear teams say, hey, I heard that other program is using a checklist or has a brochure that could be really helpful for me. Is there a way that I could get that? It's a great way to get new tools, not only specific to quality improvement, but perhaps to the area of work that you're looking to improve. Kind of feeding into some of the other things that we've talked about, it's an opportunity to network with other home visiting programs and models. So these could be programs in communities that you don't typically work with, but you can find those common challenges and common solutions together. That networking is really important. And also, participating in a learning collaborative allows for greater awareness and visibility in the state of issues that really affect the quality of home visiting services received by families just across the state of Michigan. It gives us a chance of knowing a little bit more about what's happening amongst our communities of need and what's happening on the home visiting front in Michigan across the state. And overall, this participation in learning collaboratives, specifically the Michigan Home Visiting Initiative, really helps us as a state work towards making those necessary improvements on the MIECHV benchmarks and constructs. This is a very structured way to be able to work towards those required improvements within benchmarks and constructs. We have of the QI Learning Collaborative that you'll be able to expect. Those that are perhaps most obvious, given our grantee meeting that's happening next week, are our 3 in-person meetings. So we'll have those 3 grantee meetings this year in January, coming up next week, in May, and then in September. Within those grantee meetings, we're actually going to convene our learning collaborative groups within those grantee meetings. So 3 times this year we'll be meeting up with a group. I'm sorry, I have to mention that all of those dates say 2014. I should mention that these are actually, in fact, all in 2015. Sorry about that. I'm still clearly on 2014 time and haven't made the shift over to 2015. But we'll be meeting in person 3 times this year, not only to talk about just the Michigan Home Visiting Initiative in a more general sense, but to come together within your smaller learning collaborative group. First, to plan out your project, to really check in to see how things are going, and then to really be able to debrief on how things went. There will be 2 action periods within this year in which you'll be implementing your tests for improvement. And overall, you'll be completing a QI project. You'll have some QI tools that we'll give you and that you'll kind of pick up along the way. And you'll actually create a QI team charter and a summary storyboard that tells us about what you did in your QI project and how it went. We will walk you through both of those things. And another important component of the learning collaborative model is that there's this piece of ongoing data collection. So not only will we ask you to continue your data collection efforts either through the data that MPHI helps collect through the supplemental data collection form or your caregiver interview. You'll continue doing this, but you also may find yourself needing, as a QI project, to be collecting some more specific data related to the project that you select and that your team really chooses to focus on. So there is a component of ongoing data collection that your team should be prepared for. To go deeper into what you'll expect when we meet in person, we have our initial meeting next week on January 15th of 2015. We are going to work together to really start out your projects, to set the stage and dive into that plan stage of the PDSA cycle. We'll help you write an aim statement and examine your current approach. So looking at the process as it exists, at the baseline data that we have and that you may have for that particular process, and looking at the root causes related to that problem. As a group, we'll also look at identifying potential solutions. We'll use a structured brainstorming approach to really get out there all of the potential solutions to the problem that your learning collaborative has decided to tackle. And your team is going to develop an improvement theory. So that's that if we do this, then this will happen. This is the improvement that we think we'll see approach to planning out your quality improvement project. Between the first meeting and the second meeting is one of the action areas where you will go back to your program and you will either finish planning up or you'll implement your test for improvement. Then we'll get back together for our second meeting on May 28th of 2015. At that point, we're going to get together and review the data that we have. We'll discuss what's been working and what hasn't been working as your program has been working through your quality improvement project, and we'll modify those improvement theories as necessary. Sometimes we feel like once we try things out and get a little bit further in the planning process, sometimes we have to make tweaks to our plans, and we'll get together at that second meeting just to check in about what might need to be modified or tweaked moving forward. Then we'll have our third and final grantee meeting of this fiscal year on September 24th of 2015. At that point, we're going to review the data again. We're going to study the results of the test. So we're going to compare the baseline of our projects, where things started out before we implemented our test for improvement, and compare it to the data at the end of our project, and make a decision about how to act. Do we want to make a standardized improvement? Is this something we want to implement on a more permanent, formal basis? And we always want to take time to celebrate, because we know that this is an in-depth process. It sometimes takes a lot of work, time, and energy, and we want to make sure that we look back, pat ourselves on the back, and really celebrate the work that you all are doing to not only meet the needs of families, but continually improve the way that you are meeting the needs of families. So we'll take time to celebrate on that last meeting in September. We have our learning collaborative topic areas, and it's important to let you guys know that the areas that we focus our learning collaborative work on are really based on the 2014 federal report that's been submitted for Michigan MIECHV. So when we do that yearly report to HRSA, we are then able to take that data and look at our summaries and see where are there areas where, as a system, this isn't as individual programs, but as a system of home visiting in Michigan, where do we see some opportunities for improvement across the state? And in that process, we found 3 areas that we thought might be some really helpful topics to focus our quality improvement efforts into the learning collaboratives. And those are, first, improving the adequacy of prenatal care. Second, supporting positive parenting practices. And third, supporting healthy development. So you actually saw all of these in a survey sent to your site. Well, at least some of your site may have seen this. Likely supervisors were able to take a look at this, hopefully share some of these topics with the team, because we asked each team to then let us know their first and second preferences. What are the top 2 topics that you feel like are really relevant to your program's work, where you really feel like you have a good understanding or have a good opportunity to make an improvement? We received all of your site preferences, and we're actually in process today and tomorrow of finalizing our learning collaborative topic areas and which programs will be in which particular collaborative. So I have talked a whole lot, and I'd really like to know if this feels clear, if other questions still exist for you as an individual or as a site. So let's take a couple minutes to get some questions from you all. What questions do you still have related to quality improvement, PDSA, learning collaboratives, and how those all fit with the Michigan Home Visiting Initiative? I also remind you all that if you'd like to ask a question and don't know why I'm not answering, make sure you unmute your phone before asking. So feel free to unmute and ask any questions that you have. I'm going to take the quiet and the silence as we're not quite either ready to answer questions or there aren't any questions that are lingering. I'll invite you all to certainly be thinking about quality improvement and the learning collaboratives that are coming up. And if questions do come up, jot them down, bring them to next week's meeting. If they're important questions that you want to reach out to Robin, Brenda, or myself moving forward, I will leave you with our contact information in just a moment. Feel free to reach out if you ever have any questions just about what all of these things mean, how it works with your site, and what you can expect in participating not only in CQI efforts, but the learning collaboratives as they are getting kicked off next week. We're going to get the pleasure of seeing all of your faces next week at our first grantee meeting of the year. This is located at the Laurel Manor Banquet and Conference Center on Schoolcraft Road in Livonia. We are going to be meeting next week on Thursday, the 15th, from 9:30 in the morning till 3:30 in the afternoon. Mentioned you're going to expect that we're going to walk through some of the planning steps of our of our Learning Collaborative QI project, but we'll also take some time during our meeting together to talk about some Michigan Home Visiting Initiative updates and other things related to MIECHV across the state. Thank you all for participating today. I hope this was helpful in establishing that foundation of why we talk about QI, what CQI is, how we use PDSA as a method to do that, and what you can expect in participating in our learning collaboratives that are, as I mentioned, getting kicked off next week. I'm leaving you here with a slide that has my contact information, also the contact information of my colleagues, Robin Vandermoor and Brenda Dietrich. If you have any questions about quality improvement, how to do these things, and how it fits in with your work, in the meantime, before we get to see you in person next week, please don't hesitate to either email us or call us. We're always happy to be able to connect with our programs on an individual basis. So be in touch if there's any questions. And otherwise, I'll bid you all a very good day, and I'll remind you that you'll be able to find this recording on our SharePoint site likely by the end of the week. So if you have any colleagues who might have missed this, but you think could benefit from participating and listening to this particular webinar, feel free to direct them to the SharePoint site. So with that, I will wish you all a great day, and I'll look forward to seeing you all next week. Take care. Have a great day.